Hello, my name is Jill. My job title is Macmillan Senior Oncology Clinical Nurse Specialist. It's a wonderful opportunity on this National Cancer Clinical Nurse Specialist Day to celebrate the fact that at Buckinghamshire Healthcare NHS Trust we have some phenomenal cancer nurse specialists. They cover all the tumour sites, and we have about 9 different specialist tumour sites for clinical nurse specialists. And then we have some additional nurse specialists that cover and support patients from teenager and young adults and also within acute oncology. And all these roles are key in providing our patients with comprehensive support from the point at which they have a suspected cancer right through to the point at which perhaps their treatment is completed and they're going to be discharged, or maybe their treatment is changing and they're going to be referred on to some other practitioners. It takes a really quite robust, resilient and special kind of person to be a clinical nurse specialist, because this is a role that requires the practitioner to be alongside the patient at some of the hardest points of their care pathway. So they are present when patients are being diagnosed and told sometimes some very complex and difficult news around a cancer diagnosis. And then they may well be present again when patients are being told about the response to their treatment and whether they may need subsequent treatment. And often this means that when the patients and their family and their friends are experiencing some very tough news or perhaps having to make some really difficult decisions, the clinical nurse specialist needs to be ready to support them, to give information, to guide them to resources and services that can help them, and to do lots of things that sometimes you may not even imagine nurses get involved in. So perhaps talking about family needs, housing support, financial needs. So I was very lucky that I joined the Trust over 22 years ago and started as a lung cancer clinical nurse specialist and worked in a team that supported not just lung cancer patients. Actually, we also did brain tumour patients and also head and neck cancers. And I loved that role. I was very, very lucky. And stayed within that role for over 20 years and then eventually moved into overseeing and supporting some of our other nurse specialists. And I can honestly say the best thing about my job is that I work with some amazing people and then also meet and become connected in the pathways of care for amazing patients. And I feel very privileged to have done that, and I feel very inspired in a whole host of ways working alongside such experienced nurses with so much energy to offer the services and the care that they give their patients.